رحبوا معي بداية مع السعادة الدكتور إدوارد. بداية أهلا وسهلا فيك دكتور and welcome with us in my TV channel.
Thank you.
The first, Dr. Edward, what you can tell us about yourself, about your name, where are you from, and how you start your successful story in UAE from start beginning to here.
After my graduation, which was a long time ago in 1983, I did the specialty in France for 3 years, and then I went back to Lebanon to teach at the dental school. And due the circumstances in Lebanon, I had to come here in 1987, where I joined Tawam Hospital. It was a small dental clinic. I am basically a dentist prosthodontist. And from that time, in 1987, we tried to develop the dental services in Al Ain. And we managed actually to increase and expand the dental services at Tawam Hospital by building and engaging and initiating a very large dental center which took care of all dental specialties. And we started in 1994 under the umbrella of Tawam Hospital and the Ministry of Health. And this dental center covered all kinds of dental specialties. And especially, which is my specialty, we started the specialty of dental implantology, which is the science of replacing missing teeth with artificial devices which is implanted in the bone of the man. And since 1994 until 2012, I was not only expanding the dental services and organizing the dental education system in the dental center. So I organized all the educational events, scientific lectures, dental events, dental continuing education, and I was part of the examining body, licensing body in Abu Dhabi, at the Health Authority in Abu Dhabi, where we carried on the process of licensing new dentists and in all specialties as GPs and specialists in dental science. Since 2012, I decided with my wife, who's a GP, to move from the dental services at Tawam and set up our own dental private practice, which has been successful since 2012 because of the long time I spent here in Al Ain city. Many, I wouldn't say hundreds, but maybe thousands of patients know me from the dental center, and they all were very welcoming and very, very supportive when we started the center. And since then, we treated thousands of patients, covering all dental specialties, which is GP fillings, aesthetic dentistry, pediatric dentistry, orthodontics, and mainly my work, which is prosthodontics and dental implantology. So far we have been successful, thank God, and that's thanks to the excellent safety and security of Al Ain city provided by us, by authorities. They are very supportive and organized, very well organized regarding the licensing and the renewal of the permits, official permits, and all the process. Until now, we have had no issues, all except successful surgical procedures to replace missing teeth and help our patients restore their chewing function.
Nice.
And their aesthetic needs as well.
Right now, 12 years about your private dental. What you can tell us here? What you have services here exactly? What is special about your dental clinic here?
Yeah, mainly since I have been accredited by the American Academy of Implant Dentistry as a fellow since 2007, after passing through a long licensing process and examining process, which includes presentation of complex cases and the development and finishing of 50 complex cases of dental implantology or full mouth rehabilitation. So this is what I mainly do in our dental. Our center is mainly specialized in dental implantology and oral surgery. And dental implantology it can go from simple cases like replacing one missing tooth to rebuilding or reconstructing a full mouth, which is totally edentulous by the means of dental implants and the implant supported prosthesis. So far we had thousands of successful cases and we had many thankful patients. We have, thank God, a very good reputation in Al Ain and Abu Dhabi. And I contributed in Abu Dhabi as well in a clinic for 5-6 years, setting up their dental implantology services and prosthodontic procedures.
Right.
So far is good.
Dr. Edward, what you can tell us right now about your vision in the future? How you see yourself and your medical dental clinic in the future?
What I would like to see that maybe the authorities would like to impose more quality care inspection on the clinics, because I have some feeling from the patients that I received some few days that we have some failed cases due to maybe inappropriate training of the dentist that has maybe practiced especially the dental implantology science. So what I would like to have from the health authorities more close control on the training and certification of the practicing dentist to avoid any failure and to avoid any problem with any patient receiving care in a line area.
Dr. Edward, what you can tell us about yourself, about your doctors inside this dental? How you choose your doctor and how many doctor you have who has helped you out this dental clinic?
Here in our dental center we have 4 doctors. We have 2 GPs, Dr. Rula and Dr. Hatem, excellent with the pediatric care and aesthetic care and regular family dentistry. We have an orthodontist, Dr. Jabbour, who is a teacher at the faculty at the dental school in Lebanon. He is a visitor every 3 weeks. We organized the patients for him for orthodontic specialty, which is very important with the children in the term of growth so that it will affect the alignment of the teeth and restore the good alignment of the teeth. And I am here for the prosthodontic specialty, restoring missing teeth, dental implantology, oral surgery, and that's it. And we are doing very well, thank God.
You are talking about the safety and security in UAE. How are you feeling about that, about your life and about your work?
On a level of personal and the level of professional, in the past maybe more than 30 years I have been here in the Emirates and in Al Ain area especially. I couldn't thank God enough for the safety and the security which is provided by the authorities in United Arab Emirates. I have been in France. I have studied many years in France, few years in the States. I did my certification, and I can't say that security-wise nothing is compared to United Arab Emirates, and especially in Al Ain area. So we thank God for every minute for that.
And what you have thanks message for Highness and the Princess in UAE about what he gave us here, about everything, about the safety and security, and good choosing to make it any work in UAE.
And the governing body of the United Arab Emirates, which is composed by our revered sheikhs and governors, they have been very, very wise, very accommodating, especially for people who are coming as expatriates from other countries. We have never felt that we are not welcome here. We have patients as friends for more than 30 years now. We received many VIP, many sheikhs, and we have been treating them very well, and they have been treating us very well. We can't thank enough the authorities in the United Arab Emirates for their accommodation and their cooperation with us as expatriates and as a community to ensure that our living here is fruitful, safe and secure.
Every 6 months or every 1 year, we are seeing too much updating for dental clinic and the machine and everything.
Yeah.
What you have technology about your dental clinic right now in U1?
Since we started, we tried to set up a modern dental care center. So over the years, we accumulated many good modern equipment like the cone beam CT scan, which takes a CT scan of the jaws of the mouth, and we can measure the bone volume of the arch so that we can choose the right size dental implants without hassling the patient, without giving them difficult times during the surgery, which was an excellent tool for diagnosis and for surgical execution. And recently we have whitening as well, whitening machines. We have laser machines. We have digital X-ray machines, which is reduced the dose quantity and the radiation on the patient. And recently we acquired a very practical machine, which is an intraoral scanner, where we take impressions just with this intraoral scanner, digital scanner, which is like a camera, instead of taking impressions with the silicone and the regular impression materials, which is now sometimes is disrupting and not so comforting for the elderly patients.
Doctor, and finally, about who support you at your life, at your work, what you can tell him thanks in my TV channel and my program.
Your program is very important actually to shed some lights on the success stories in the United Arab Emirates. There are hundreds and thousands of success stories, and you had a good initiative of documenting these success stories and showing it to the world. My personal first thanks is to the authorities. our governors, our sheikh, our governors, the whole system, for their understanding, for their friendly feelings towards the expatriate and towards the doctors, healthcare professionals. They have been very supportive and very cooperative.
What about your family, about your friends? Who support you and he push you to growing up more on that?
We managed to raise our kids in this secure and safe society of Al Ain. Now all my three boys, the first one has just graduated from Boston University in Boston as an orthodontist, and my second son is a medical doctor. He is studying in Boston, Harvard University, and our third has managed to do the business administration, and he's working in New York at a hedge fund financial institution. So we were lucky to have a very safe community in Al Ain to raise them and to give them a good education.
In the finally, we tell you from my TV channel, good luck for everything in the future, and nice to meet you.
Thank
because
you.
you are loving this country and you are growing up step by step here, and you want to stay here more on that.
Sure.
Thank you so much, Dr.
Thank you for your time. So this is our X-ray room, which is completely leaded to protect the patients from the radiations. First, this is a machine which is the CBCT, the cone beam CT scan, which we use for planning and diagnosis before the dental implant procedures. So this will allow us to get the exact volume of bone prior to placing the implant, so we can choose the right size implant for each case and for each site that we need to replace. And this is one of the cases where we restored the patient completely with 2 arches, and both they had about 15 implants, and to restore with the fixed prosthesis, which is implant supported. Besides the cone beam CT scan, this will take a full mouth X-ray panoramic, and this is this cephalo for orthodontic treatment, cephalo X-ray. Besides that, we have the digital intraoral scanner, where we take the impressions with the digital camera inside the mouth, which will prevent any discomfort for the patient, and it will be more accurate and more successful than the usual impressions with silicone.
مرحبا واهلا وسهلا فيكم في مركز شوفاني لطب الاسنان. نحن هون في المركز بنقدم لكم خدمات متنوعه تشمل جميع انواع علاجات الاسنان، من التسوسات للاعصاب وغيرها، وبنشمل ايضا تعويض الاسنان المفقوده من خلال زراعه الاسنان او تعويضات الجسور والتيجان، وتجميل الاسنان ايضا. وهنا ايضا نشمل علاجات اللثه بجميع انواعها.